Hi, Anna. How are you?
Hey, I'm doing well.
So thanks so much for hopping on today. I know you and I have a pretty cool topic that we're going to get into. We were just going to share with everybody a little bit about group therapy, the benefits of group therapy, and then we're going to announce officially the group therapy that we are starting up at the beginning of May. So, to get started, do you want to just share some of your thoughts on the benefits of group therapy, what group therapy actually looks like, what people might expect walking into it?
Sure. So, I mean, groups differ. There are psychoeducational groups, which are usually larger in size, and there's not a lot of sharing involved. It's more just kind of teaching skills or providing information that people can then use on their own. But what we're going to be doing is kind of a closed, smaller group. So, a closed group is when you register ahead of time. There are known people that are kind of involved after the fact, and that allows for a sense of safety and for people to develop relationships. And in a closed group, more often there is sharing involved and kind of interaction with other people. And there can be the experiential element where people practice skills together and also just have a chance to see someone else who's experiencing something really similar to them, which in itself, decreases shame quite often, makes people realize that they're not a problem, their problems aren't unusual. And I think that does quite a bit to heal people too. So, yeah, our group will probably be 6 to 8 people, which is the usual small group size, typically what's recommended. Um, so I think those are just off the top of my head a few benefits and then what group looks like. But people can expect that in the beginning, it'll kind of move slowly. There'll be a lot of time spent building group norms and comfort between group members and things like that, and orienting people to kind of the topic. So usually first 2 sessions aren't gonna be too sharing heavy or not too much experiential stuff, just to build comfort. And I'll say too, at least me as like a group facilitator, if people don't wanna participate in the experiential things, I never pressure people either. Like, we're a trauma-informed clinic, so we're not going to be having people do anything that they're not comfortable with, and we can work on baby steps and stuff like that. So,
Yeah.
yeah. What
Yeah,
about
that's
you?
fantastic. So yeah, when I do a lot of group work, and I do both the psychoeducational stuff and the more therapeutic sharing side of things with my groups. And that's one thing that I always really preface the group with is you're here for yourself and you're here to get what you need out of it. So if what you need is to sit back and listen to other people's experience and kind of internalize and learn from that, then just show up for yourself that way. But if what you need is to be there and to share and to hear other people kind of respond to that experience that you've had, then share away, right? So it really is, it's a group process, but you're there as an individual. So like you're not going to get pressured into anything, right? That's something that I always just really
Yeah.
want to bring that safety for people. And like what you had said before about that reduction of shame, creating that space where it's okay to be vulnerable with others. And we had talked a little bit before we hopped on the call today about the transferability of group work. So the group that we're going to be doing is boundaries and assertiveness, and kind of learning how to really identify what your boundaries are and what your needs are and how to communicate those effectively. So, talking about that in a group setting and being able to share and experience that with other people around you is a lot more transferable than sitting one to one with your therapist, because it creates that confidence in yourself that you can communicate your needs in front of other people, right? So then when you go back to the real world and you're out of that, safety bubble of the therapeutic process, you can kind of say to yourself, well, I've done this in front of people that I barely even knew. So yeah, I know I can handle it and I know I can do that. I find it really helps with confidence in actually taking action.
Yeah, that's a really good point, the transferability. I think another benefit of group 2 is that you can have examples of multiple ways to kind of work with
Mhm.
something. So, when you're doing the experiential process, if you have people kind of presented to the group, it gives you other words to use, like different language than you might be used to. And I think that's kind of cool too to hear that the same skill can be used in like 4 or 5 different ways. So that's another
Yeah.
thing about group. Yeah.
Yeah, I like that too. And as therapists, we can bring forward different tools and perspectives, but as a group of people who are all living with similar experiences, or like the similar but different, you
Yeah.
get so many new perspectives and new approaches. And one thing that I really enjoy about running groups and working with groups is how much I learn about how people apply these tools to areas that I would never have even thought to, just because that particular thing might not be in my life, that I wouldn't have thought about applying it, right? So then people come in like, well, I actually tried it in this really specific scenario and it was great. And you have other people in the group like, oh, I go through that too. I'm going to try that. So there's a lot more like cohesive learning because you have so many more experiences all in one place.
Yeah.
Yeah.
Talking about this is making me really excited for our group.
Me too.
Yeah. Oh, like, what a good point. Yeah, group is a really good tool. Uh,
Yeah, so then I guess a little bit about our group as well. Like I mentioned, it's assertiveness and boundaries. But what we're going to be doing in the first session is sharing with people how we're going to be asking people, I guess, sorry, I got distracted.
that's
We're going to
okay.
be asking
Yeah.
people kind of what they really want to get out of it. And we're going to tailor the rest of the group to make sure that we're meeting the outcomes that the group is expecting or needing.
Yeah, so for us, we want it to be, kind of collectively developed. So the first session will probably talk a little bit about assertiveness and boundaries, do some kind of quiz to determine what people feel like they need to work on, and then go from there to kind of maybe sketch a little bit of an outline with the group so people know what to expect, but also everyone can take part in designing it. And then as we go, we'll probably be flexible if new things come up and everyone in the group says, oh, I'm really interested in going deeper into this, and we'll do that. So we do have ideas and a bit of sketches, different topics and things like that, but we're open to kind of making it work for the people who register.
Yeah.
Yeah.
Awesome. Well, I think that's a great place to leave off for today. And if anyone is interested in participating in the group, they can send an email to Rising Tides. So hello@risingtidesnb.com. We'll add that in the description for the video. And yeah, we'll be having, I guess we'll probably be posting the official dates and times and all that kind of stuff early this week.
Sure. So I think that originally we planned to kind of do it for about an hour and a half, maybe on Thursdays, and we're thinking about morning. But if people say, that really doesn't work for me, then we can try to figure out something else.
Mm-hmm.
And right now we're planning to do like probably $120 for 6 weeks of group. But that can also be explored further. So.
Yeah, absolutely. Awesome. Well, thanks so
Okay.
much for joining and getting me all re-inspired and excited to get this going again.
Yeah, no, me too. Good to see you.